for tuning in. This is Heather Davis with EdenCultures.com. And on BioTech today, I want to talk about something that's very serious. It's medical kidnapping, and it's awful, and I think it's murder. I think it's absolute murder. I'm talking about the mainstream medical situation with forcing people to take certain treatments. If you guys remember, there's a teenage girl by the pseudonym or whatever, Cassandra C., and she didn't want to take chemotherapy. She had refused treatment, and Connecticut's highest court ruled that she had to take it. She then ran away from home, and so the Child Protective Services there took her from her mother, saying that the mother wasn't doing her due diligence to get the child to her treatments, and she's been forcibly undergoing chemotherapy ever since. Now they're coming out with this article of propaganda. I'm not saying she's not in remission, but I'm very familiar with what their terms mean. Remission means that the cancer cells are going away and or that the, quote, activity in the cells is decreasing. Now, if any of you know that my mother died of cancer in late 2010, you probably also know that she was given 3 months to live initially. In early 2006, she didn't want to do chemo and she didn't want to do any of that. And they gave her the choice because she had such a bad prognosis. She was diagnosed with a different cancer than this girl. And they gave her 3 months to live, and she did a natural protocol for 6 or 7 months, living well beyond her predicted time span. And I believe that the natural protocol did that. 4 tumors out of her 5 disappeared off of scans. I was there in the doctor's office with her, and I asked the doctor, and he would say things like, oh, the radiologist just didn't report them because they don't matter. It's only the big tumor that matters. And I would say, well, what about the big tumor? It's getting smaller, because she was only doing natural treatments at first. And he would say, oh, well, that just means it's going to implode and spread. It's going to implode and spread everywhere. That's all it means. And she had gotten off of all kinds of medicines from this natural protocol that followed along with World Without Cancer Foundation. It was everything except the Laetrile, believe it or not. And she was on one final medication, which was a SSRI, Zoloft. And she wanted to quit it because she wasn't happy with the results, which now that I have this pre-med physiology degree, I understand that her results were phenomenal. But her activity inside of her tumor was increasing, and the doctor was making her scared because of that. And the final tumor was getting smaller. It had reduced by about 10% in a matter of months, and he was making her think that that meant it was going to explode. And so she quit her medication, cold turkey, and that's very dangerous. And she didn't eat for 3 days, and she went in for a checkup. They drew blood, and she passed out from low blood sugar. And so the doctor took that upon himself to say, it's now or never. If you don't do chemo, you're going to die. And I'll never forget that day, because if only I had my degree then, I could have given him a piece of my mind. So she did the chemo, and it would say that she was getting better, and then it would stop working. And then they tried another chemo, and it would say that it was working, and then it would stop working. And then she tried another chemo. And then finally they gave her a biological agent. Now, this isn't what's happening to this girl, but I'm getting to a point. That biological agent ended up, after about 4 years of treatment. Remember, she had about 6-7 months of natural treatment, outliving her diagnosis, and then about 4 years of traditional treatments, which I don't think she would have lasted that long if it weren't for the natural protocol first, which completely built up her nourishment. Finally, it did implode on itself and explode and spread everywhere, but it was the biological agent that did that, not the natural treatment. And my mother died, and I subsequently finished my pre-medical degree. And so when I see things like this, it makes me want to scream. This is actually my second take, because the first one I started screaming and talking about, how this is Satan's world. And so I'm going to try to tone that down. But this girl was medically kidnapped, strapped to a table. Here's what she said. Now that her phone was taken from her, And she's saying now that she just wants to go home. She just has 2 more cycles and she misses her life. They had removed her phone and returned it, but it wasn't working well, so she couldn't actually do a phone interview. I will never be okay with how this happened. Being taken away from home, hospitalized, and especially being strapped to the bed for the surgery of the port placement. Although I haven't had any major side effects besides hair loss, I still wish I was given the right to explore alternatives. She has Hodgkin's lymphoma, and there's a lot of connections between this particular cancer and fungal overgrowth, which is very easy to take care of. That could be perhaps why there's an 85% quote cure rate with Hodgkin's lymphoma. But what's happening here is they're using this as propaganda to say, look at Cassandra C. She was endangering her life and we saved her from herself and she's going to be cured now. Okay, but that's not the case. So now she's saying, anyone should have that right, but hearing this news makes me able to accept the chemotherapy and I just want to get it over with. And they're arguing that she should be able to come home. And they're using this as a propaganda machine to say, hey, take your medicine or this is what's going to happen to you. And, it'll cure you. But they're not taking into account secondary malignancies. And Hodgkin's lymphoma does have a really high, quote, cure rate. But it also has a very high secondary cancer rate. And so they'll say that she's a survivor because she will go into, quote, remission based on their terms. Okay, they're not addressing the fungal infection. They're addressing their terms of what cancer is. Remember, the activity in my mom's tumors was increasing while they were going away. Remember that. When she went back on chemo, her activity would decrease, but then, bam, it would spread every time they'd lay off the chemo and she'd take a break. And so they attributed that to, she needs more chemo. The chemo was causing it. So they're saying they're helping her now, and she'll probably be fine for 5 or 10 years. And so they'll call her a survivor because she'll survive for 5 years. But the risk of secondary malignancies is high after giving her this type of thing, which is like mustard gas or related. Evaluation of long-term complications and over 1,000 patients with Hodgkin's disease said they had a 7-fold increase in death from causes other than that compared to the normal population. The specific risk of dying from a second cancer was 6 times. In patients treated younger than 21, the risk was even greater with a 14-fold increase in death from a second cancer. Not a 14-fold increase in disease that you can live with. Death. The irony of this, they're going to call her, like I said, a survivor, is usually it happens in a decade or more later, after their 5-year term. So they can chalk up their success after forcibly poisoning this girl. And later on, when she shows up with breast, thyroid, bone, colorectal, lung, or stomach cancer, they will once again pat themselves on the back in some demented way, I'm sure. So the real question here, guys, is why is this allowed to happen? So this is a serious BioTech today. This should not be allowed to happen. She was 17. She had a job. This is because of money. This is because of patent laws. This is because of the FDA saying that only a drug can treat, cure, or prevent an illness. They are criminals. They are murderers. And these people, these courts that ruled that she should have this treatment, these people that aren't medical professionals or health professionals that are ruling this, they will be judged. And the medical professionals that are using the system to draw their paycheck without doing their due diligence on the safety and efficacy of the drugs that they're administering forcibly, they will be judged. And this girl, Cassandra C., if you ever watch this video, feel free to please reach out to me. I'm not going to cure your cancer. I can't, but your body can. and there are people that can help you, and I would love to help you get that information. Please remember to sign up for our newsletter at edencultures.com/sign-up. Please remember to subscribe on YouTube, and remember that we have everything we need to heal ourselves. We don't need this poison. We can seek it out in nature. It's been given to us. It's hard to find all the knowledge, but it's possible. Have a great day, guys.